we've got Dr. Art here answering your health questions. You're so good about sending in emails, so we have a few of them here.
Yes.
And Cindy from Mesa, morning to you, Cindy. She has our first question. She says, Dr. Art, my 3-year-old daughter has had a cough for the last several days. Which over-the-counter cough medicine do you suggest?
Right. You know, I don't suggest any over-the-counter cough medicines for children under the age of 4, and that's according to rules set down by the FDA. What I usually suggest is medicinal honey, although honey cannot be given to anyone under the age of 1, so that's one caution. I usually suggest lots of fluids, steam, that usually helps, and sometimes some nasal type of sprays, a saline solution to open up those areas, but nothing as far as over-the-counter for those children who are under the age of 4.
Okay, hope your daughter feels better, Miss Cindy.
Yeah.
And then Donna from Glendale says, I'm 55 years old, developed shingles 6 months ago. Can I get it again, and when can I get the shingles vaccine?
Yeah, well, most of the research suggests that a lot of people can get shingles again, maybe 7%, 10%. Shingles is an excellent vaccine. They use the Zostavax vaccine, which has been around now for quite a few years. It's very efficacious, but it's only 50% effective. There's a new vaccine, and it's called Shingrix, and that's 90% effective, but it's 2 shots instead of 1. So you get 1 shot, and then 2 to 6 months later, you'll get another shot. So shingles is something that can come back. It's caused by the chickenpox virus that lies dormant in your spine, and it exacerbates from time to time when your immune system gets compromised. So it's an excellent shot to get, but if you've had shingles, you cannot get a shingles shot for at least 1 year after the acute outbreak.
After you get it, okay.
Yes.
And then Jenna from Scottsdale writing as well. She asks, I'm 29 years old. I suffer from chronic fatigue. Honey, who doesn't? Although she says she does get 8 hours of sleep every night, she still wakes up exhausted. So what's the problem?
Yeah, well, first of all, it may not be restorative sleep. So you may sleep 8 hours a night, but you're not getting that type of restorative sleep where you get up and you feel refreshed. The problem generally with chronic fatigue is it's caused by many different things. Recent research has suggested that it may be caused by inflammation. You can get a blood test known as the C-reactive protein test. You can go to your doctor's office. That'll tell whether there is inflammation. Chronic fatigue syndrome is a medical conundrum. It's a puzzle that we don't have all the answers for. So it can be caused by a lot of different things. It can be caused by depression, anxiety, underlying medical conditions can cause it. It's really not a clear-cut answer in terms of what we can actually do for it. So get some research done and see your doctor.
We have a lot of questions. We have one from Vince over in Phoenix, and he says he wants to know, does acupuncture really help for back pain?
Well, it helps if it's in the hands of the right practitioner. So there are a lot of different people. Make sure it's a professional who's doing the acupuncture. I like acupuncture for low back pain, but you have to discern what the underlying cause is. Let's make sure that it's not a herniated disc. Let's make sure that it's not even an underlying cancer or something like that. So I think you have to first see your doctor, get an examination, maybe even get an MRI of your lumbar spine to find out exactly what's going on. But acupuncture can be very effective for people who have low back pain.
And we have one last question. This one's coming from Monica in Scottsdale. She says, my 7-year-old son has lots of allergies and received a flu shot, and now his arm is red, it's swollen, and it's sore. So what do they do?
Well, it's not uncommon to have some redness and swelling at the injection site, particularly in children who have allergies. If they have allergies, they're going to be more prone to having an inflammatory process going on there. I suggest taking ibuprofen over the counter and also Benadryl to prevent any type of allergic reaction. So it's not uncommon, particularly more common in children who basically have allergies.
Okay.
So, but it goes away and it will get better, sure. Yeah.
So if you have questions for Dr. Art, you can email him at askdrartmollen@gmail.com. You won't get a fast response next weekend, though, because you will be out at the 42nd annual Phoenix 10K.
Exactly, because 42 years and we're still doing it. There's a 5K, a 10K, a half marathon, a 1-mile fun run for the kids. So everybody needs to come out. You can go online and register right away.
Yeah, see all your friends out there, and you can see the Soretta family out there as well. Thank you so much.
And everybody gets a t-shirt and a medal.
Everybody wins.